Guinea and Sierra Leone have both reported just 3 new cases each in the last 2 weeks. Liberia has no new cases, but was already declared Ebola-free in May, only to suffer a relapse in June.
Organizations continue to support national efforts, with several thousand specialists working alongside national staff in villages and towns as well as in the capital cities. If the current intensity of case detection and contact tracing is sustained, the virus can be soundly defeated by the end of this year. That means going to zero and staying at zero.
She reiterated the broadly accepted view that the lack of public health capacities and infrastructure created the greatest vulnerabilities.
The African Union and the US CDC are jointly establishing a communicable disease control system that will help African nations be better prepared for outbreaks. The first step later this year will be the establishment of an African Surveillance and Response Unit, which will include an emergency operations center and workforce.
She also indicated efforts to mobilize funds for distribution once promising vaccine trials in Guinea win approval from regulators. The WHO has long admitted its response was inadequate. In its words, slow and insufficient, largely due to the size of the West African outbreak. Some of the reforms include the establishment of a global health emergency workforce, an operational command structure that can move more quickly into high gear, and the funding needed to do just that, in the form of a $100 million reserve fund to support any unexpected surge requirements in the future. Sherwin Bryceby's SABC News, New York.